Good afternoon. I'm George Latimer, Westchester County Executive. It is Monday, August 9th, and this is our Westchester weekly update, 2 o'clock on Monday afternoons every week. I'm joined, as I always am, by our Deputy County Executive, Ken Jenkins, and he and I, along with representatives of our Department of Health, will give some updates on some of the issues that we're facing in Westchester County as of today. The COVID health crisis has come back to the top of the list of all of our concerns. It never was far from the top, but in late June we had thought that we had really turned a significant corner and we're headed in a very positive direction. Active cases were down. We were down to single digits of hospitalizations, and our fatality rate was fairly low. That has now turned around significantly since then. As of the information that we have from the New York State Tracker, as of yesterday, Sunday, August 8th, we have now 1,827 active cases of coronavirus. That means individuals that have tested positive for coronavirus and have not gone through the 2-week period of time in which they have defeated the virus through their own antibodies or built-in defensive system. 1,827 cases. In that low date, back in late June, we were at 175 cases, so we've gone tenfold over the course of these 5 or so weeks, 6 weeks since the end of June. The number of people that are hospitalized is also now concerning. 51 individuals were hospitalized as of yesterday. We had only 7 hospitalized that week in June, and we went for quite a while in the mid-20 range of individuals. And even as the number of infections spiked, we did not see a commensurate increase in hospitalizations, but in the last week we've doubled. From just Monday a week ago when I reported to you we had 26 hospitalizations, we're now twice as high. Dr. Charlita Amler, our Commissioner of Health, and Dr. Dow Hewlett, who's also one of our principal doctors in the Department of Health, will address some of these issues in a second. But the increase in hospitalizations is concerning, and what we're dealing with, as I think we've talked about before, is the process of the number of infections, the number of hospitalizations, and the number of fatalities. Our fatality numbers have still stayed relatively flat over the course of this time. If you go back a month, we've lost 3 people in the last month, which is a low number of fatalities. It is 3 tragedies in 3 separate families and groups of people that love them. But the fatality rate has not yet jumped up, but the increase in hospitalization rate concerns us. The more people that are hospitalized, seriously sick with COVID, the more likely that there are people within the possibility of losing their life to COVID. And ultimately, these are the things that we care most about. All of the procedures that we discuss fit into the context of having the concerns about our health and how many people suffer and will die. Our vaccination rate continues to rise. We now have almost 81%, 80.9% of all of our population 18 years of age and older that have had at least 1 vaccine dose, and we're now approaching 70% of our total population. Now, that would include young people who are ineligible for it, for the vaccination. So to have the total population almost 70% and the adults 18 and over 80% is really quite a success. We outrank the counties immediately around us in New York State. The Bronx, Rockland, Dutchess, Orange, and Putnam counties are all behind us in rate of vaccination. We are still concerned, however, that with the number of people that are vaccinated, we still have almost 20% of the population that's unvaccinated. And while that's a small percentage, that's a lot of human beings, a lot of individuals. We are just shy of 1 million people in Westchester County, so if 20% are unvaccinated, just to use very general numbers, we're still talking about 200,000 people. Even if 800,000 are vaccinated, 200,000 are unvaccinated. Those numbers are very generalized, but to give you an idea of the threshold. And that many people unvaccinated can spread the disease and is spreading the disease as far as we can tell. We don't have hard numbers on this, but it is pretty clear that those who are unvaccinated are both more likely to get the disease, and because the Delta variant is much more communicable, more likely to spread the disease. So all of these numbers are not encouraging, and I've been happy to tell you encouraging news when the news was encouraging, but in the world of straightforwardness, the numbers are not good. Now, we are not yet at the crisis situation that we experienced either in January or last year in April or May. In January, we reached 11,500 active cases. 1,700 active cases is still well below that number. We had 588 people hospitalized at the peak in January after the holiday season, so at 51 we're still 1/10 of that number. But the rise that we've had in the last few weeks and the last month and plus is concerning. And if that trend line continues, what we're particularly concerned about is within the month, we will be having children going back to school in some capacity, and probably by the middle of September, late September into October, we will be going back indoors with more of our activities. So we're concerned about it, and some of the actions that we take are built on that concern. Before I ask Dr. Amler and Dr. Hewlett to discuss this, when I do close, I'm going to close with some very general comments about what is happening in our society and the battle that's going on between those who have individual rights and assert them, and at what level those individual rights are impacting all the rest of us in our individual rights. This is the kind of discussion that happens in elementary school, high school, college, in a dorm over discussions, but now it is a very real-world issue as we try to fight a disease that has taken the lives of hundreds of thousands of Americans, and here in Westchester County, just shy of 3,000 individuals. But let me make sure the professionals have a chance to speak. So Dr. Charlita Amler, from day one, in fact, before day one, before the first case was identified here in Westchester County, she alerted us to be ready for the coronavirus, and now we're approaching a year and a half in this situation. Dr. Amler has been with us every step of the way, and we appreciate her professionalism and her insight. Dr. Charlita Amler, Commissioner of Public Health in Westchester County.
Thank you, County Executives. So I wanted to report out that currently the majority of our COVID positive cases in Westchester who are hospitalized are among the unvaccinated portion of our population. The largest age group from the data for the period of July 25th through July 31st was among individuals aged 30 to 50 years of age. The second largest group hospitalized were among those 16 to 29 years of age. Now, obviously, both of these groups are eligible for vaccines, since anyone over the age of 12 can be vaccinated for COVID. So I would just like to remind everyone that the best way to prevent serious disease and death is by getting vaccinated for COVID. And that does mean 2 vaccines if you're getting Pfizer or Moderna, or 1 for Johnson & Johnson. So protect yourselves, protect your family, and let's try to keep people out of the hospital. Get your COVID vaccine. Thank you.
And next we'd like to hear from Dr. Dal Hewlett, who will talk to us a little bit about the pediatric implications. Dr. Hewlett.
Yes, thank you, County Executive, and good afternoon. As far as pediatrics is concerned, I think that all of us know that at the beginning of this pandemic, people thought that children were not affected in a severe way, and we learned last year that that is not the case. There have been a significant number of children around the country who have developed severe complications as a result of this infection. Now, just last week, if we look at the total number of cases for actually the final week of July, there were 72,000 cases of pediatric COVID in the United States. This represented 19% of the total. And so we're talking now about close to 1 out of every 5 cases is involving a child. And as Dr. Amler already mentioned, children under the age of 12 are not yet eligible for the vaccine. We have been told that the vaccine for children is probably not going to be available until sometime after January. And so between now and then, these children, our children under the age of 12, are totally dependent upon us. They're dependent upon us to make sure that we are vaccinated so that we can actually protect them. So we're urging you to actually get vaccinated. We don't want to find ourselves in the situation that they are facing in other states. If we look through the news, we see that in the state of Florida, in the state of Texas, in New Orleans, the children's hospitals are being overwhelmed by the numbers of cases of severe disease that they have to manage in children. And so we don't want that to happen here in Westchester County. So our children, our grandchildren, our nieces and nephews are counting on us to get vaccinated. And I'll put in a plug that we are offering vaccines at the health department in Yonkers, New York, 20 South Broadway, every Monday and every Thursday between 4 and 7 o'clock. You can walk in and get vaccinated. Your children can get their childhood vaccinations, not yet COVID, but the children who are 12 and over can actually get the COVID vaccines. Every Friday, we are here in White Plains at 134 Court Street, and between 10 in the morning and 1 in the afternoon, you can walk in and get your COVID vaccine. So thank you very much.
I do want to thank Dr. Charlita Amler and Dr. Dial Hewlett, both of whom are our leaders in our Westchester County Health Department, for their update on the coronavirus issues as we see. As we continue forward, we want to highlight that we are in dialogue as county government with our local school districts. There are 44 school districts across Westchester, a couple of them crossing into Putnam County, and we have a conference call scheduled on Tuesday to discuss the issues that are on hand for the reopening of schools. Now, in the past year of the pandemic, New York State Department of Health has issued guidance based on CDC advisories, and they have created the mandates by which the school districts have operated. New York State DOH informed us within the last week that they would let those decisions be made by the local school district with the assistance of the county health department. So Dr. Amler, whom you just saw here, and her team we'll be working with each of the different school districts, and each school district will make a determination as to how they're going to handle their back-to-school arrangements. There's a wide range of options that are open to all of them, and the county health department will work with them on each of these issues. There is no across-the-board county health department mandate that applies to all school districts. The executive branch of the state government has left those decisions to the school district, so consult with your local school district as to what's going to happen in your school area. Those issues of vaccines and masks are certainly at the top of the list. We're dealing with them in Westchester County as a government, and each of the school districts will be dealing with as we can. We are going through the process of setting up vaccine satellite clinics at local schools to make sure that students and teachers get vaccinated and try to increase that percentage of people who are better protected from the disease. And as we work with these local school districts, I'm sure each of them will announce what their procedures and policies are to the local parents and the school children in that area. And again, whatever those ones are, they'll become apparent to all of us. We have normally had during the school season a once-a-week call on Mondays, Monday mornings at 8:30. We will continue that practice as the school year begins, but tomorrow we expect to have a more substantive conversation. There may be some news that comes out of that, and we'll discuss how we express that to the public. Next, I'm going to ask Ken Jenkins to talk to us about our back-to-school vaccine clinics. Ken.
Thanks, George. And Dr. Hewlett gave a little preview of it earlier in the conversation today on the stream, that there'll be free back-to-school vaccine clinics. And that's not just for the COVID vaccine, because only folks that are 12 years old or 12 years of age or older are eligible for vaccines at this particular time for COVID-19. The Moderna or Pfizer are the only two that 12 to 18-year-olds can be that are eligible for. Over 18 for those that would have the Johnson & Johnson as well. So the County Department of Health is now booking appointments for its free back-to-school vaccine clinics in Yonkers. And Dr. Hewlett said Mondays and Thursdays from now to the end of August. And on Friday in White Plains, starting this week to the end of August, for the children to have the vaccine and immunizations that they need for school. And remember that those children who do not have their required immunizations must have their first dose of vaccinations within 14 days from the first day of school. So basically, the middle of the month for most folks. Some folks are starting school before Labor Day this year because Labor Day is so late. So please keep that in mind. Those clinics are free. The county health department will be able to help families that have no insurance, child health care, Child Health Plus, or Medicaid. You should call the county health department to schedule an appointment for vaccines, again, at no cost. The number's on the screen, 914-995-5800. Find out if you qualify and make an appointment for your back-to-school clinic. Remembering again, the County Health Department at 20 South Broadway in Yonkers or at 134 Court Street here in White Plains. So Anyone who would like a COVID-19 vaccine is also welcome to come to these clinics with no appointments during those times. Again, but for the young folks, for those your school-age children, it is extremely important for them to get their MMR and their other immunizations. Thanks a lot, George.
Thank you, Ken. Thanks very much, Ken. Just a few other issues to update you on before we close out today. We're making progress here in Westchester County amongst our county workforce and trying to ensure that as many of our workers can be vaccinated as is possible. We have a campaign called Just the Facts, We're Vaxxed, and we're encouraging that to happen between now and Labor Day. We have had a number of departments already indicate that they've had 100% vaccinations. This is done voluntarily. It's not done by a mandate, as some other governments have structured it. But we're also trying to address the problems that those who are unvaccinated have with taking a vaccine or not. We've had a couple of situations. One department, we had an unvaccinated staffer that just got her first shot after she discussed the pros and cons with the head of her department. In another case, we had a staffer who had had COVID and had very strong antibodies, but she agreed to get her first vaccine on Thursday after speaking with a supervisor and realizing that the antibodies that were created by prior COVID infection would not protect you now, the Delta variant, and you could again be reinfected and suffer through that again. So these are small battles, one at a time, department at a time, group of people at a time, but we're trying to have the kind of dialogue that we as Americans believe in, which is an honest discussion of issues. We know that people have strongly held beliefs, but by the same token that we must listen to different points of view to try to understand what is the best path forward. We've also created a video in Spanish to promote mask usage and to explain the new mask mandates that we have at some of our county facilities. Here's an opportunity to see what we're communicating.
Hola, me llamo Marta López y soy parte del equipo administrativo de la Oficina del Ejecutivo del Condado George Latimer. Tengo un mensaje que el Ejecutivo del Condado le gustaría compartir con todos ustedes. El Ejecutivo George Latimer está restableciendo un mandato obligatorio donde la mayoría de las instalaciones del condado tendrán que usar de nuevo la mascarilla. En todos los edificios de oficinas del condado de Westchester, los empleados no vacunados y las personas que nos visitan deberán, una vez más, tener sus mascarillas en todo momento. Esto incluye los departamentos de salud y de servicios sociales. Para aquellas personas que están vacunadas, deberán usar sus mascarillas en todas las áreas comunes, como pasillos, ascensores y vestíbulos. En las playas y piscinas del condado, se deberá usar mascarilla cuando la persona vaya a comprar comida o requiera ir al baño. Debemos trabajar juntos, permanecer fuertes para seguir avanzando. Gracias.
And we want to thank Martha Lopez of our executive team for her work in being able to provide this information in Spanish. Each weekend we try to share with you the parks numbers of what we've had. We have quite a lot of county parks all across the county. We don't normally do head counts for each of the different parks when nature trails and nature centers have an ebb and flow of individuals. We do look at our pools and our beaches, all of which will close on Labor Day, as will Playland Amusement Park. The attendance over the week from August 2nd to August 8th continues to be good given the weather circumstances. 33,262 people visited Playland over the course of the week. That brings our annual total to 205,000 visitors. You really can't compare that number with numbers we've had in past years because of we're closed an extra day a week and we open much later than we normally do. But we wanted to open up the park this year once the state allowed it to happen so that we had a reintroduction of Playland, and we're pleased that we're getting some decent attendance. In the last week, we had 5,308 people go to any of our 3 beaches, and that brings the year-to-date total up to 47,321 individuals. That's well ahead of last year, but then again, this year we've had Glen Island open, and that's the largest of our beaches. We get the best attendance at Glen Island, so that puts us ahead of last year. Our 4 pools have 11,783 visitors this past week, bringing the year-to-date total up to over 107,000 visitors, so all 4 pools. They opened on time, same time frame as last year. Last year we had a reduction in the number of people that could come as a capacity, and so in the same time frame year-to-date we had 85,000 a year ago, so we're pacing a good amount of 22,000 people ahead of where we were last year, given the difference in restrictions. And the rounds of golf, which does not require any social distancing, once again are ahead of last year's pace. Last year was a tremendous year for golf, and this year has been even better than last year. Year to date, we have 154,000 rounds of golf. Last year, 149,000 rounds of golf, and we're well on our way to breaking the more recent year record that we've just had with all 6 of those golf courses. We're very appreciative of the hardworking staff at the Parks, Recreation, Conservation Department for managing all of these situations. And I should point out that at the beaches and the pools, we've had additional mask requirements. The mask requirements we don't believe are onerous, very similar to what we did last year. When you walk into the beach or the pool, you must have a mask on. When you keep the mask on as you go to wherever you're going to set up your blanket. Once you set up your blanket and your umbrella and whatever else you have there, when you are on that blanket with your friends and relatives, you can take your mask off and have a normal, enjoyable time. And when you go to the water, you do not need to have your mask on, whether the water is the pool or the beach. However, when you walk through the crowd for any other purpose, going to the restroom, going to throw something in a garbage can, going to a concession stand, you need to put your mask on. That's when you're potentially interacting with other people in a normal social context. Come back to your blanket, take it off, put it back on as you exit, and we think those are very reasonable requirements, and we think that will help us with any potential spread. Just want to mention one other initiative in the general area of healthcare, and that is an agreement that Westchester County government signed with the Montefiore Health System that once again gives our 16,000 county employees, retirees, and their families in-network access to all Montefiore facilities. They had lost that coverage because United Healthcare, which is our medical benefit provider, did not come to agreement with Montefiore in providing Montefiore services, and therefore all of the Montefiore network individuals were no longer accessible to the county workforce as of January 1. This deal is a direct deal between the county and Montefiore. It takes care of the financial obligations. So if you work in the part of the workforce, and you have doctors or any other people that treat you, providers with Montefiore, you're now eligible to do that again. This decision was made by our executive team because of we care about the health and the welfare of our workforce. And we state about this publicly because we think it's reflective of how we view our responsibilities. Our responsibilities are to the workforce, but they're also to the people at large, and we continue to try to show a compassionate way to deal with problems. Many of these problems that we're dealing with, COVID and others, are very difficult. They're not easy to resolve. It's not just, common sense do this. It involves working through a host of different difficulties. When we can do those things and still cut taxes, when we can do those things and still see a drop in crime, when we can do those things and still see an increase in the value of our homes through the real estate market, when we can do those things and see an increase in vaccination, then we are balancing off all these pressures that face us. And hopefully we're doing that in an intelligent fashion, and the Montefiore arrangement was one more of those such things. Of course, over the course of the last week, we highlighted the completion of the seawall at Glen Island, which goes back to Superstorm Sandy. We highlighted the good news that was reported to us by the Hudson Gateway Association of Realtors, that the home values and prices are on the rise, the economy is on the rise. So we try to keep you posted on these things and give you an accurate picture of what we face. I'm going to ask Catherine Chaffee if we have any questions from members of the press.
We do. We have 2 questions from David Proper from the Journal News. He asks, the first question, what power does the county have to institute mask mandates for private businesses?
Well, the Commissioner of Health, whom you just saw, Dr. Charlita Amler, has wide authority, as does the Westchester County Board of Health, to impose those mandates. They can act outside of my authority as county executive. The commissioner reports to me, but I do not have the direct power to do those things. The county health commissioner does. She exercises those authorities in concert with the Board of Health, and as we've discussed them to this point, those mandates have not yet manifested. For those people who are looking, what is the reason why, we're looking at an increase in infections that have not reached yet the level of greatest experience in the past. We're still about 1/10 of where we were at our prior peaks. The closer we get, if that rise continues, then that is an option on the table. It is also possible that we could flatten out. We might reach a point, which happened the first time around, where infections rose to a certain level and then stopped rising and then ultimately started to diminish down. We know that any mandate is going to have pushback. We know that there are people in the society that do not want to be told what to do. Even if legal authority is behind that order, they resist it. Whatever they fall back on, their understanding of their constitutional rights or what have you. We're not looking to create conflict, and we're not looking to restrict people's lives. Whatever actions get taken will be done because of what's in the best interest of public health. And there are times in this world when the individual's rights have to be protected against all other factors, and there are times when the individual rights have to be subordinate to the needs of a larger group of people who also have individual rights. This is, as I said earlier, this is a much debated topic in school settings, but now we're here in the real world trying to find that median. We are not talking about lockdowns at this stage of the game. The power to do that does exist within the county health commissioner. Currently, the executive branch in Albany, the governor, if you will, is choosing not to exercise authority. Obviously, these are difficult days in Albany. And so the power and the responsibility falls back to the county government through the county health department. And we're trying to work through these things. And certainly if we see this infection rise beyond a reasonable, manageable point, then all options are on the table.
And the second question also from David is, and this is the last question for today, is what is the county recommending businesses and residents do about masking?
Well, at this stage of the game, we're still operating under the state's rules, which only require masking in public transportation, in hospitals, nursing homes, a host of other specific institutional settings. They have not determined that masking is necessary or required at this stage of the game. We're following the CDC advisories. In the past, the CDC would issue an advisory, and we waited for the New York State Health Department to determine if that was going to be the rules, because New York State Health Department had the authority, and once they established it through the executive branch, we then in the county government had to implement whatever the state did. So it was the state decisions to impose reduction of number of people in a building, to close certain types of businesses. All of that authority reside at the state level. Now that that's not going to be used, the authority falls within us, but we are going to calibrate our response to the degree of the problem in front of us. Now, as always, as they say, blessed be the peacemakers because they will catch it from both sides. And a path that says let us be alert to what's happening on the ground, but let us act proportionate to that does not satisfy those people that want to see masks mandated, vaccines mandated, and lockdown. And it also doesn't satisfy the people that assert a unlimited constitutional right to be unmasked and unvaccinated in whatever setting they are. Meaning it's not just enough not to have it. They want to be able to come and go as they normally would and do so being unvaccinated, unmasked. So we are at neither extreme. We are looking for what we think is practical at this point, given the degree of the infection, given the degree of the concerns. We are trying, as we said from last week, to vaccinate our own workforce, which we have some control over. But we do not have universal control because there were bargaining agreements between the county and those workforce unions. And if we said get vaccinated or get fired, that would be outside of our authority. The bargaining agreement doesn't give us that authority. So we are trying to work intelligently. And I hope the majority of you understand that, see that. Now, we're a county government. You're going to hear more about what's going on in the state and the federal government in your day-to-day living. But we are in contact on a regular basis with municipal officials, the town, village, and city officials. We're in direct contact with our county legislatures and our state legislators for their opinions and input, and we're always ready to hear from the state executive branch with whatever direction they give us. In the meantime, we're trying to chart an intelligent, responsible course, which we're prepared to ramp up or ramp down, depending on what happens on the ground. If we see a reduction in the number of infections, a reduction in the number of hospitalizations, then we will be more than happy to relieve some of the mandates we have, such as coming in the county office building, where you must wear a mask. If this thing gets much worse, if we see greater fatalities, then we're prepared to take more action. But it's calibrated around whatever is on the ground. It's not driven by ideology. And people who hold strong ideology do not want to hear that. They have a worldview, and it's a fixed situation, and this is an absolute or this is an absolute. And sometimes it's the moderates of the world that are the enemies of both, because they see in our moderation something weak or something lacking, when in fact the great strength of America has always been our reasonability, our ability to stay cool under pressure, our ability to find the common ground where it exists, and not to move to one extent to the other. World history is littered with countries that moved very far to the left, very far to the right, had conflict, destroyed, the social compact of their country, and went through terrible disaster because of it. That happened here once in the Civil War. But hopefully we'll find a rational way to deal with this as we go forward. I'm George Latimer, Westchester County Executive. Thank you for watching. If you're a member of the media, you want to follow up with us, please give a call to Catherine Chaffee, our Director of Communications, at 995-2932. We plan to update you next week. We'll announce the date and time, perhaps location. We might be out in the field, as we are sometimes, or we might be right here, hopefully with no technical difficulties. Thank you for watching, and thank you for your patience. Have a good day.